Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about knee pain. So I want to go over 3 ways to foam roll out your knee pain. So most people don't realize that tight muscles and limited mobility can affect your joints, or what may seem like it's affecting your joints. So in the office here, we do a lot of foam rolling. So that's what I want to show you today is just different ways to hopefully help that knee pain. We can roll out the tense muscles in your legs. I actually do have a personal experience with this. I was a college athlete. I was having a lot of knee pain, so I ended up having knee surgery. I did have a slight tear in my meniscus, but even after surgery, I was still having knee pain. It was still bothering me a lot. And I found out that my hips were tight, my T-bands were super tight, which are right here down the side of my leg, and it was causing a lot of tension pulling here on the upper portion of my knee. The more that I've foam rolled, the more it's loosened up, and I don't have any knee pain anymore. I can run, I can work out, I can do whatever I want, and I have 0 knee pain anymore. So it's very helpful, but most people don't know about it. So this is what a foam roller looks like. You can find them in almost any sporting goods section in a store. There's different sizes and textures, and then there's different densities. So some of them can be very compact and hard, so it puts a lot more pressure on it. But then others can be kind of squishy on the outside, softer foam, so it doesn't hurt quite as bad. So you can kind of take your pick. I like to use the harder one because I feel like I'm putting more pressure on my muscle and it's gonna push through there and get the tension out a little faster. All right, so let's start here. The first way we're gonna do it is we're gonna lay it horizontally like this, and then you're just gonna kind of get down on your stomach. You're gonna start it about right below your hips. We're just gonna foam roll out the quads. So those are the big muscle right there in the front of your thighs. You're just gonna start right about there, and then you're gonna be on your elbows down, and then kind of army crawl your way forward like this. Just kind of rolling it up and then back, just like that. What you're gonna feel is if there's a knot or some really tense spot, it may hurt a little bit, so you can stop in that one spot, maybe let it loosen up a little and then roll it out again, just like that. So that would just be for the quads. Then what you can do is if you have lateral knee pain, so knee pain more on the outside like I did, you're gonna roll out your IT bands, which are there on the outside of your leg. So you're gonna start up by your hip like this, and then you're gonna gently roll it down the side of your legs. You can go all the way down towards your knee. When you get to your knee, stop, go back up. Again, if you feel a spot that's very tender, kind of roll over it, really try to release it, and then just keep repeating. This one will be very sensitive. It may hurt a lot more on the side than it did on the front. All right, and then the last way is to roll out your adductors. So your adductors are here on the inside of your legs. So what we're gonna do this time is move the foam roller vertically like this, and you're gonna lay beside it on your stomach, and then you're gonna lift your knee up and onto the foam roller like this. So you can keep your knee bent, and then you're just gonna kind of move laterally like this so that it's moving up the inside into your groin area, and then back down towards your knee like that. This one is also very sensitive, especially down by your knee. It may be a little more sensitive, but again, just up and back like so. Nice and slowly also. No, don't try to rush it. What I would recommend would be to use it for about 1 to 2 minutes a day. Obviously, the longer you do it, the better. Really try to work it out, really try to get the tension out for as long as you can. The better, the sooner it will feel better. And like I was saying, it's gonna hurt. So if you need to take breaks between, if it gets too painful, that's perfectly fine too. Just keep pushing through the pain, try to get those muscles to relax a little more. But yeah, so that's been this week's Fitbit, and we'll see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.